Have a good day. Today we're going to talk about abdominoplasty or abdominal procedures in general. We are having a new technique which we are using, which is called inverse abdominoplasty. We even wrote a book about that. In the abdominal area, the ladies are having usually more problems than men because of childbearing, because of weight gains and weight loss, and there are different problems and of course different options. Depending on the problem of the patient, we are having 3 different options for a patient. There are a group of patients who are having kind of like a fat accumulation but not a bad skin quality and a nice abdominal wall. Then we can do a small liposuction in order to get rid of the skin excess, and we can, in like half an hour, 45 minutes, we can really solve the problem of the patient. If there's a problem with the abdominal wall and not too much skin excess, then we can do a mini abdominoplasty. We do a small incision, go inside, make application, and get rid of the skin excess in a small fashion. If there's any laxity of the abdominal wall, if the rectus muscles are opened or there's skin laxity, then we have to do a full abdominoplasty. The problem of full abdominoplasty used to be threefold. First of all, it was a very long operation, really very painful operation, and as a result we were having a kind of like a flat abdomen, but it was not sexy and we couldn't create the rectus muscles and the nice Coke bottle shape. So what is a full abdominoplasty? Usually what we do, we just open the abdomen through the cesarean section scars, get rid of this whole skin excess between the cesarean section and the umbilicus. That skin and the fat is taken off. Then we are doing an inner corset in order to create the Coke bottle shape, and then we get rid of the skin excess between the umbilicus and the pubis. Just pull the skin down and close. The whole process takes around 1.5 hours. Usually the patients stay at the hospital for 1 night just in order to keep them at bay, but they will not have any pain at all after the surgery. The next morning we can send the patients walking back to their home, and after 1 day they come back to us. We just check the patients and let them to take a full shower. And usually on the 4th, 5th day they can start going back to their social life, and after a week absolutely they can drive their car, they can go back to job and go basically to their normal life. Usually after a week they can be normal in the social environment. After 3 weeks time they can get rid of their garments. After a month usually basic training is free, but of course the abdominal training is forbidden for the first 3 months.